Hi folks, I'm Vic Luebker and I'm running for Congress. Over the coming months, I'm going to share with you a number of video blogs talking about the current issues affecting all of us. Today's blog is going to be a reality check on health care. 4 months ago, we conducted a study internally to get to the bottom line of what the health care numbers really were. We started by looking at the VA health care system. And in that system, if you look at the numbers, you'll early on find out that it costs the VA approximately $45 billion per year to treat 5 million patients. Although there's 27 million veterans in the system, most of them use private insurance, TRICARE, and their employee-based plans. Now, if you take that number over 10 years, you come to find out that it will cost a full $500 billion over 10 years to treat just 5 million patients. That was a red flag for us. We soon realized, how can you treat 40 million Americans in a government takeover of health care and it only cost $890 billion? So we then contacted Health and Human Services, program and organization run by President Obama and Secretary Kathleen Sebelius. We found someone on the inside of HHS that sent us a shocking study on health care. And in that study, there's a unique number that keeps popping up. It's the cost of health care for the uninsured. The first number they gave us was 39.5 million patients. That's a number we're hearing a lot of, 40 million. So immediately we said, that makes sense. But then as it broke down, we realized right away that most of those patients were covered through Medicaid, Medicare, private insurance. And HHS's own internal study shows that only 2.3 million Americans were not insured. And of that, 50% were in the 18 to 44-year-old range. The point is, my friends, is that your Congress has been misleading you all along, both on cost and numbers. This isn't about health care reform. This is about health care takeover. If you look at those same numbers and apply the VA standard to it, you soon realize that there's no way you could possibly treat 40 million Americans for just $890 billion. But then you realize, after looking at the numbers, there's only 2.3 million that need to be covered to begin with. At the end of the day, the problem is simple. We don't need to blow up health care. We need to reform it. We need to make it more affordable. I firmly believe in that. And there's simple ways to do that. One, tax incentives for the poor and middle class. Let them take their tax dollars and buy their insurance anywhere they want. Don't give it to the federal government. Let them buy their insurance. Number two, open up insurance across state lines. Let individuals buy insurance anywhere they want, anywhere in the country. You'll immediately see cost savings as competition heats up. And then last, establish medical savings accounts for everybody else in the country to give them a tax incentive to save for their medical health care and have them go after the best possible care money can buy. At the end of the day, these three simple reforms will actually save us money in the long run and make sure every American has quality health care that they can afford, that they use their tax dollars to pay for, and with any kind of program they want, whether it's a Cadillac plan, an employee-based plan, Medicare, or anything like that. Folks, at the end of the day, health care is about choice, not about a federal government takeover. It's about your choice and your tax dollars. These numbers that are out there right now are absolutely misleading all of us, and we have the study to prove it. Now, I encourage you to contact me to get a full copy of this report. At the end of the day, we'll continue to share these reality checks with you throughout the coming year as we campaign for Congress. I want to thank you for paying attention, and I want to encourage you to share this video with everyone you know. I'm Vic Luebker, and I'm running for Congress.